Do you struggle with back pain? Maybe in your lower spine, maybe all the way up in your neck. You've tried stretching, massages, even medication, and still, nothing works. But here's the surprising truth. The real problem may not be your back or your neck at all. It might be your pelvis. Yes, the pelvis. That central structure at the base of your spine. It's the command center of your body's movement. And when it gets blocked or locked, it can create pain that travels everywhere. In this video, we're going to uncover the mystery of pelvic blockage. You'll learn what it is, how it affects your health, and most importantly, how it can be released. The pelvis is like the crossroads of your body. Above, it connects to the spine. Below, it anchors your legs. Inside, it holds your organs. Through it, countless nerves and blood vessels travel. Anatomically, the pelvis is built from three main parts. The sacrum, that triangular bone at the base of your spine. The two iliac bones, one on each side. And the sacroiliac joints, or SI joints, where they meet. These joints only move a few degrees, but even the smallest restriction here can throw off your entire posture. Think of the pelvis as the conductor of an orchestra. If the conductor loses rhythm, the whole orchestra falls apart. When the pelvis locks, your whole body has to compensate. And that compensation leads to pain. So how does the pelvis actually get blocked? One cause is trauma. A fall on your buttocks, a side impact car crash, or lifting something heavy with poor form. All of these can jam the sacroiliac joint. Another cause is posture. Sitting for hours every day, leaning on one leg, crossing your legs constantly. These habits tighten tissues and shift the pelvis out of balance. Third, we have visceral issues. Things like constipation, painful periods, or urinary infections. They can cause spasms in the pelvic floor muscles. And those spasms pull the pelvis into dysfunction. Finally, there's neuromuscular imbalance. The stabilizing muscles, your pelvic floor, deep abdominals, and spinal stabilizers, aren't working in sync. One side of the pelvis stiffens. The other side moves too much. Over time, the whole system becomes unstable. Here's the tricky part. Pelvic blockage doesn't usually hurt exactly where the problem is. It creates pain in other places. Back and neck pain are common. When the pelvis tilts or twists, your spine must compensate. That strain climbs up to your neck, even to your jaw. Some people even develop headaches or jaw pain from this. It can also affect digestion and urinary function. Maybe you feel bloated after meals. Maybe you're constipated. Maybe you feel like you have a urinary infection, but tests come back negative. All of that can be linked to pelvic floor tension caused by a blocked pelvis. Then there's joint pain. Hips, knees, ankles, even feet. Doctors may tell you it's arthritis, but the real problem is the pelvis throwing off your biomechanics. And finally, nerve issues. The sciatic nerve runs through this region. So does the pudendal nerve, which controls sensation in the genitals. If the pelvis is blocked, these nerves can be irritated, causing leg pain, genital pain, or burning sensations. This is why so many people spend years treating the wrong thing. They're told it's their spine, or their hip, or their gut. But the pelvis is the hidden culprit. When you see a doctor for back pain, what do you usually get? Painkillers, muscle relaxants, maybe physical therapy for your lumbar spine. If you complain of hip pain, you may get x-rays, maybe even surgery. But none of these address the root cause. Even mobility exercises can backfire. Imagine one sacroiliac joint is locked, the other side moves double. All that extra motion causes irritation, and you end up worse than before. That's why pelvic blockage needs a specific, integrated approach, not just generic stretching or strengthening. So what actually works? How do we unlock the pelvis? Step 1 is proper assessment. A skilled practitioner, often an osteopath, chiropractor, or integrative therapist, has to evaluate the pelvis by hand. Imaging like x-rays usually looks normal, but the dysfunction is real. Step 2 is manual therapy. This might include osteopathy, gentle techniques that restore ligament balance and free joint motion. Chiropractic adjustments. Precise manipulations to release the sacroiliac joint. Myofascial release. Stretching tight fascia and connective tissue. Step 3 is visceral and pelvic floor therapy. If the internal muscles are in spasm or the organs are irritated, those issues must be treated. Otherwise, the pelvis keeps getting pulled back into dysfunction. Step 4 is neuromuscular retraining. Once the pelvis is free, the deep stabilizers have to be retrained. Breathing exercises, core stabilization, pelvic floor relaxation. These keep the pelvis balanced. And step 5 is whole body integration. Because the pelvis doesn't exist in isolation. If you grind your teeth, your jaw may need treatment. If your feet collapse inward, orthotics or gait training may be required. Balance the whole chain and the pelvis stays free. Let's look at a few cases. Case 1. A woman with chronic back pain. 5 years of suffering. MRI showed only mild disc changes. Nothing helped. Until her osteopath found a blocked sacroiliac joint. After just a few sessions, her pain dropped by 70%. Case 2. A man diagnosed with hip arthritis. His x-rays showed mild wear, but his pain was severe. The real problem? A blocked pelvis. Once released, his hip pain disappeared. Surgery avoided. Case 3. A woman with constant urinary urgency. Doctors thought it was infection, but every test was negative. The true cause was irritation of the pudendal nerve, triggered by sacral torsion. Manual therapy fixed the problem. Stories like these show just how powerful pelvic liberation can be. Science is starting to catch up. Reviews in journals like Manual Therapy show that sacroiliac dysfunction is underdiagnosed, but strongly linked to chronic low back pain. Osteopathic studies reveal that manual therapy restores pelvic balance and reduces symptoms, even in conditions like sciatica or digestive complaints. We still need more large trials, but the evidence is building. Biomechanical modeling and functional MRI are opening new doors to prove what practitioners have observed for decades. The lesson here is bigger than just the pelvis. It's about how we view the body, not as separate parts, but as a connected system. A problem in one joint, especially a central joint like the pelvis, can echo through the whole body. This challenges the reductionist model of medicine. Instead of only treating the symptom, we need to search for the root cause. For you, that means asking new questions. Could your neck pain really come from your pelvis? Could your digestive issues be linked to your posture? Are you treating the symptom or the source? Your pelvis is the body's biomechanical conductor. When it gets blocked, your whole body falls out of tune. Pain spreads, function declines, life becomes harder. But here's the hope. With the right integrative care, the pelvis can be freed. If you've been living with pain that never seems to resolve, don't overlook your pelvis. Find a practitioner who understands anatomy, who can assess the sacroiliac joints, the pelvic floor, and the way your body connects from head to toe. Because once the pelvis is liberated, the body can return to harmony. If you found this video valuable, please hit like. Subscribe for more deep dives into hidden health truths. And share this with someone you know who struggles with chronic pain. Remember, your healing may begin with your pelvis.